Orthorexia, when clean eating becomes clinical. This video will explore the topic of orthorexia nervosa, which is a disordered eating pattern. Disclaimer, this video is purely educational. Please get in touch with your physician should you need assistance or have questions about orthorexia nervosa.
Let's take a look at orthorexia nervosa and understand what it is. Orthorexia nervosa is an eating disorder comprised of an obsession with healthy eating and the associated restrictive behaviors. Unlike other eating disorders, orthorexia nervosa focuses on the quality of food rather than the quantity. This obsession preoccupies individuals with the disorder and affects their health by disrupting other aspects of their life. Some signs and symptoms of the disorder include experiencing fear of unhealthy foods, unable to deviate from a specific eating style without anxiety, spending unusually long times on planning meals, avoiding social events and gatherings with friends, experiencing unintentional malnutrition or weight loss, and obsessively checking nutrition labels and ingredient lists. The prevalence of orthorexia nervosa is highly variant on the specific group being studied. Although it has not been studied to the same extent as other medically diagnosed eating disorders, its prevalence in the general population is estimated to be around 5%. That being said, the disorder occurs more in women than in men because of the emphasis of the appearance of women by media outlets. Additionally, recent studies have established that the disorder is more common in specific groups such as athletes and university students. Although anyone can suffer from orthorexia nervosa, those with close relatives with eating disorders or a history with dieting have a greater chance of suffering from the disorder. Additionally, those with trauma in their life from being teased about their weight are also at a higher risk. Although there are no official tests to diagnose an individual with orthorexia nervosa, researchers have proposed various criteria and tools to help with the diagnosis. Two diagnostic tools include the Bratman orthorexia test and the Deselderoff orthorexia scale. Other researchers have stated that an individual can be diagnosed with the disorder if they have an obsessive focus on healthy eating, get distressed over food choices, and notice physical and mental health problems as a result of it.
Let's discuss the potential onset of orthorexia nervosa. Over the recent years, we've seen an increased interest in healthy food free from contaminants and substances considered unfavorable to health. Although beneficial, this may take on the form of pathological anxiety and obsession with the quality of food consumed. This tendency may give rise to orthorexia nervosa. Next, let's discuss how orthorexia nervosa escalates. People with orthorexia pay special attention to the quality of food they eat, which leads to the elimination of certain products from their diet. Dietary restrictions escalate over time and can include the elimination of entire food groups, the addition of dangerous cleanses or fasts, or even both. In order to maximize the health benefits of eating, an orthorectic person may create specific patterns of behavior, for example, by not combining certain foods or eating selected foods only at specific times of the day or at specific intervals.
Unfortunately, there is no official treatment, so usually it is treated like anorexia. Treatment teams usually consist of physicians, dietitians, and psychotherapists. The first treatment is behavioral modification strategies, which are usually discussed with a psychologist or therapist. This can include positive or negative reinforcement training. The second possible treatment is a medication called antipsychotics. This is effective in decreasing obsessive ideas around food. This has been a successful therapy for other disorders like OCD. The last possible therapy is relaxation training. This can help overall with anxiety related to food stress.
Do you believe you or a loved one might have orthorexia nervosa? The following information will discuss some tips for talking to someone about eating concerns and seeking professional help. Some tips for talking to a loved one about eating concerns are to learn about eating disorders such as orthorexia nervosa, talk to the person in a private setting, be honest about your concerns and your observations of the person's behavior, avoid accusatory statements. For example, do not say, "You are obsessing too much over your food." Instead, speak with I statements. For example, "I notice you seem very anxious over what you are eating." Remove stigma by reminding your loved one that there is no shame in admitting they struggle with an eating disorder. Avoid simplistic solutions like just eat. This may make someone feel frustrated and not heard. Encourage them to seek professional help. Offer to help them find a physician or therapist, or attend an appointment with them for support. Finally, provide resources such as potential counselors, support groups, or more info on orthorexia nervosa. Seeking help and starting the recovery journey can be scary. Make sure you keep this in mind so that you can empathize with the person. Here are some tips for encouraging a person to seek professional help. Ask if they would like some help in making an appointment. Sometimes it is scary for a person to take the first step themselves, so offering to help them out may make it easier for them. If the first professional isn't a good match, encourage the person to keep trying and looking for another one. Finally, ensure that the person gets a medical checkup, as eating disorders can cause a variety of physical health problems. Who should you contact if you or a loved one is suspected to have orthorexia nervosa or any eating concern? You can call the National Eating Disorder Information Center's helpline. They are a Canadian organization who provides information and referrals to Canadians who are affected by an eating disorder. Second, the National Eating Disorders Association is an American organization that provides support to individuals and families affected by eating disorders by providing access to care. Here are some further informational and assistive resources. The links can be found in the description box below.
Thank you for watching our educational video. We hope you learned something.